crazy to me. And when you have hundreds of thousands of people without jobs and without being able to find a job, as everyone knows, COVID lasted, just over 3 months with everything closed down. That on top of the higher number of healthcare recipients or those without healthcare, it just compounds the issues that you all can understand are happening now. Everyone saw that it was just about 1.7 1.7 million people that depend on Obamacare. That number, if you include those who would qualify for the expanded Medicaid program, it does balloon to just over 3 million Floridians. So Obamacare had set up to be able to have an expansion of Medicaid, but it was an opt-in program for states. And many states like Kentucky, which I work in for the Sierra Club, opted into expanded Medicaid early, which is federal funding to be able to expand access to Medicaid to not just the poorest in our community, but those at 125% of the poverty line. And in Florida, that would help over 800,000 Floridians. So these are things that you look at in a state where, I think our priorities are backwards. Just as COVID was starting, the governor approved over $500 million in tax credits to our 0.1% of our businesses, knowing full well that COVID was happening and that our budget would have a huge shortfall. And so now, 3 months later, it's no surprise to anyone that yesterday, Governor DeSantis announced over $1 billion in cuts to the Florida budget, impacting workers, impacting educators, teachers, and public school systems in our over 60 counties. And so, things have a ripple effect, and him approving that money to the largest businesses in the state early on, and then now cutting the budget, again, putting our most vulnerable at a bigger disadvantage, are reasons why people are fed up. And in Florida, it's not just Democrats that are fed up with a broken system. It's no party affiliates or independents, and a lot of Republicans. And I'll end with this before the questions, because I know the questions are going to be really good.